Well, hi again, everyone. Happy Tuesday, and hope you had a great Labor Day weekend with your family and friends. And the first Tuesday of the month means that it is the Early Efforts webinar from the Hunt Institute. My name is Dan Worry. I am the Senior Director of Early Learning at the Institute. And for those of you who may be joining us for the first time, the Institute was the creation of Jim Hunt, who is the four-term governor of North Carolina. We are an education policy support to the nation's governors and state lawmakers and senior state elected leaders. We cover the education waterfront from prenatal on up through post-secondary, but here on the Early Efforts webinar, we focus on the early childhood portion of the work, which is near and dear, obviously, to my heart. It's great to have you with us for an important conversation today on the state of the childcare industry. It's been a difficult past couple of years for a challenged industry, and we're going to talk about what's next. I want to mention a few things by way of housekeeping before I introduce our panel. First, we are always glad to include closed captioning in these webinars. And so if that is a service that would be of benefit to you, you can find the closed captioning controls down on the Zoom toolbar at the bottom of your screen. Also want to encourage you to do two things. Jump into the chat and say hello, let us know where you're tuning in from, and meet your friends there in the chat. But if you have a question for the panel, we are going to spend some time later in the hour taking questions from you as viewers. Would encourage you to drop those into the Q&A as opposed to the chat. The chat can get awfully busy, and so it's sometimes difficult for us to keep track when there are questions in there. If you'll drop that in the Q&A function, then we'll know that it is a question for the panel, and we'll try to get to those a little bit later in the hour. I mentioned that today our topic is the state of the American childcare industry. It has been, as I mentioned, a difficult couple of years here during COVID-19 for an industry that was already in a somewhat precarious place and a challenged financial model. The past couple of years have been an extra challenge, obviously, for the childcare industry. And fortunately, because of one-time federal COVID relief dollars, the industry has managed to stave off some of the most dire predictions that were happening at the beginning of the pandemic. But we're very cognizant in our work with policymakers around the country that those one-time dollars are winding down and will soon be expended. And so the questions really now are, what happens next? Where is Congress going to go in terms of its support of early childhood education in this country? What can states be doing in the meantime? And what are the promising practices that are helping to stabilize and support the industry? I am so lucky to be joined by three very special friends today who happen to be really the three smartest people on this topic in the country. Dr. Lana Dumas of the Farrell Consulting Group and formerly of the National Association of Family Child Care Providers, Dr. Lynette Fraga, who is the Executive Director of Child Care Aware of America, and Michelle Kang, who is the new CEO of the National Association for the Education of Young Children. What a treat to have all three of you with us, and thank you for certainly for taking the time out today, but more importantly, thank you for all of your combined years of commitment to this topic and this field. It's really a treat to have all three of you with us. Lana, let's turn to you, maybe, to kick us off. You've had an opportunity to work in this field for many years, and are kind of keeping an eye on the state. Talk a little bit about the state of childcare right now, maybe from a family's perspective, in terms of what are we seeing in terms of access and affordability in the field right now?
Well, good afternoon, and thank you, Dan, for having me here. It's always a pleasure to be with Hunt, and I am super excited to share the panel with my colleagues, Michelle and Lynette. As far as, as we all know, the affordability and access to high quality childcare has long been an issue for the average American family. And like many of you on the webinar, outside my paid job, I am a mother of 5 and a grandmother of 6. And I well remember those days of trying to find, vet, and pay for childcare. And now I'm watching my adult children go through the same thing of trying to find, and vet and pay for childcare. And this hunt is made, it's more onerous if you need care in non-traditional hours, or if your children have special needs, or you want to maintain your home language or home culture, or you simply live in a rural area where large childcare tends to be a bad business proposition. And we all know that the coronavirus made the essential nature of childcare very clear to everyone, particularly the value of family childcare, 75% of which remained open even at the height of the pandemic. And most of you know that family childcare are mostly women-owned small businesses that provide early care and education from their homes. um, and while I said that 75% of them remain open, most of them remain open at reduced capacity, which has direct correlation to their income, especially for those that serve parents that are private pay and aren't connected to subsidy systems. A lot of the state subsidy systems started paying during the pandemic based on enrollment and not attendance, which was a help. But this reduction in income has caused a lot of these programs to have to close, and or take on additional side hustles and additional income sources that added to their already 60-hour work weeks, like bringing them to unimaginable hours. Also, in the center-based childcare arena, low wages and working conditions make it really hard to recruit and maintain early care and education professionals in those spaces. So families are really scrambling to find high quality, affordable care, even outside of what we traditionally call childcare deserts. So we found that nearly 20% of working parents had to leave work or reduce their work hours solely based on lack of childcare. 26% of women are unemployed because they either the cost of childcare or the inability to find appropriate childcare arrangements. So this contributed to a labor force participation reduction down to 57%, which is huge. So while it's easy to make the business case for childcare as a workforce support, there's also a case to be made in state houses, because about 20% of the revenue in state budgets, 27, I'm sorry, percent of the revenue in state budgets is typically derived from working parents. So when you have this huge reduction in the workforce, it really impacts state and local economies tremendously. So we know childcare keeps America working, and that matters to business and communities. And as far as families go, it's affordability, right? And in 2021, families spent up to 12.9% of their total annual income on childcare. And that makes high quality childcare out of reach and unaffordable for many American families, especially Black, Brown, and Indigenous families. Excuse me, I apologize for that. So we want to make sure that we actually are honest with ourselves and understand that the market cannot bear the true cost of quality care, and that we honestly need to rethink how we finance childcare and actually fund childcare as a public good. And with that, I will turn it back over to you, Dan.
Len, I so appreciate all your thoughts around the the number of parents that are having to leave the workforce. Just as one example of that, I was several weeks ago in North Dakota. The Institute helped Governor Doug Burgum there to host a series of child care roundtables. And one of the most striking things about that conversation is we went around from CEO to CEO to large employer all around this table, was the extent to which they are experiencing that very thing. In fact, one of the larger employers there in the state who was at the table said that they have lost 35% of their employees to childcare issues in the past 18 months alone. which is really just staggering as as you think about businesses and the costs involved in hiring and training and retraining. What a challenge to productivity and profitability, even from an employer's viewpoint. This is becoming. So anyway, we'll be back to you here in just a moment. I want to turn though, Michelle, maybe to you. The National Association for the Education of Young Children is really the nation's most prominent and well-regarded professional organization for the workforce in this case, for early childhood educators across the country. And one of the things that we're finding is, as Lana just mentioned, is that capacity right now is limited in a lot of cases by sheer lack of adult bodies to go into classrooms. There was a fascinating article in a local newspaper in Michigan over the weekend that was talking about how, using American Rescue Plan Act dollars, the state had hoped to expand child care subsidy. They had lifted the subsidy eligibility definition to serve a whole new population of families, and yet they saw somewhat less participation than they were expecting to because of the hiring situation. That preschools are having a terrific difficulty right now, even attracting a workforce into the classroom. So talk a little bit with us about sort of the state of the workforce right now.
Great. Dan, thank you for that question, and thank you for hosting this important topic. And I just am thrilled to have the chance to be here with you and with my fellow panelists. I am grateful to be the new CEO of NAEYC, which represents 60,000 members and 51 dynamic affiliates. And I just have to take a moment, because I see in the chat that many of our affiliates leaders are here with us today. So a shout out to our affiliates and a shout out to our many members who are joining us for this conversation. We are so grateful for you and grateful for you and our community. Dan, I think that the essential nature of childcare in supporting children's positive growth and development and in driving our local and national economies has never been more apparent than during this COVID-19 pandemic. Early childhood educators, professionals who have complex, demanding jobs and responsibilities continue to support children, families, and the American economy throughout this crisis recovery and beyond. Yet, we know from the average wage of less than $11 an hour that this threatens program supply, undermines the quality, and diminishes the benefits to children, families, and our economy. We know that as NAEYC, that in our work, that it's important that we anchor ourselves in and are driven by the experiences and stories and the expertise of our field. And with that orientation in mind, we've been surveying the field ever since the onset of the pandemic to learn more about those experiences so we can be sure that we are hearing what is happening in our communities, what's happening in the diverse geographies, what's happening across states in different areas. And the surveys have provided us valuable information about the state of the field across the country. We last surveyed our field in January, and our next field survey is coming. But what we've learned is that many of the conversations that I've been having with early childhood educators working across states and settings, including faith-based programs, family childcare homes, and small and large centers in the months since then, reaffirm what we have heard from the beginning in survey after survey. We've learned that providers are considering leaving or closing their programs. And in particularly, over half of minority-owned programs have been reckoning with this possibility of permanent closure because of the conditions of what has happened over the course of the pandemic. We've learned that providers across the country are experiencing those staffing shortages that you mentioned. It's affected their ability to be able to serve families, creating this untenable cycle where the non-competitive compensation leads to the childcare staffing crisis, which leads to closed classrooms, which leads to disruptions in quality, and these long wait lists that keep our families from being able to access quality care and also to be able to participate in the workforce if they should choose. We have a quote from one of our surveys from Elizabeth, a program director who has been serving families in Vermont. And she shared that early childhood education staff can't earn a living wage or count on benefits like health insurance. And directors can't find those qualified applicants due to the wages, the lack of benefits, and frankly, a public misunderstanding about the importance of the work of early childhood professionals. This continuing cycle has really created the conditions under which the workforce is under right now, which is that providers are not able to bring in staff, which means that it has wait lists in programs and closed classrooms. And that frankly, families are the ones that are suffering then because providers aren't providing don't have the supportive environment that they need. In some affirming news about the stabilization grants, because we don't want to be all gloom and doom today, we learned that providers have used the childcare relief to pay off debt that they took on in the course of the pandemic and to support compensation for educators, including increases through bonuses, an increase in baseline pay, or in some cases, a fusion of both. And overwhelmingly, the grants have worked and allowed programs to stay open. So those numbers in terms of how many providers would have closed would have been so much greater if the money hadn't been available. So, we are encouraged by that. We hope that there will continue to be recognition that funding, such as what was provided to programs, enables programs to stay open. It enables educators to continue to stay in their programs instead of leaving for jobs in other sectors where employers can pay staff more. And this cuts across, again, all types of programs: family childcare, small programs in rural communities and suburban communities, in cities, large providers, small providers. It's across the board. So overwhelmingly, what we're hearing is the stories from the field are that there is some moments of hope. There is incredible uncertainty, there's concern, but hope, also this belief that there's finally recognition that childcare and the educators that help make it happen are being seen for the work that they do that is so critical to young children and to families and to our communities.
Michelle, thank you. And I want to encourage everyone again to drop your questions into the Q&A function. We'll take a couple of those here in just a couple of minutes. But Lynette, I want to turn to you. We've talked a little bit about the childcare situation right now from parents' perspectives, from professionals' perspectives, and we know that the states and localities are really working hard on this issue, though we haven't seen the kind of action come through Congress at this point that I think many anticipated even 6 months ago. What are some of the promising things that you're seeing and identifying happening at the local and the state and the federal policy level right now that maybe we ought to latch on to and would like to see continue?
Well, thanks for the question so much, Dan. And again, I just want to reiterate what's already been said in terms of gratitudes to be on this panel. I know that our favorite things to do, and obviously those that are signing in still, as I see all of these folks from all over the country joining us, is to talk about how incredibly important these issues are. To your point, and to Lana and Michelle's point, I mean, community impact, employer impact, workforce impact, impact on families, and importantly, our children, which is, the core and the center of the work that we're trying to accomplish. And we're not there yet, and there's a lot of fight left to have. I appreciate also, and going to give a shout out, just like you did, Michelle, to our child care resource and referral agencies that are out there. Child Care Aware of America is a national membership organization of over 400 child care resource and referral agencies. And I know many are on the call today, as well as I'm seeing those wonderful folks letting us know where they're from. There's a lot happening, a lot of talent on the local, state, and federal front. And of course, in response to your question, many of our on-the-ground partners are critical to our ability to monitor and engage and advance policy at the local, state, and federal levels. So I just want to say thank you to everybody who's joining us. You're literally and figuratively part of the panel today. So I want to first begin by speaking a little bit to the public policy investment that's been central to our conversation in the past couple of years. Historic amounts of funding were passed by Congress to stabilize, emphasis on stabilize the childcare sector under 3 legislative packages. So to be clear, we're all sort of speaking from the same space. The Coronavirus Aid, Relief, and Economic Security Act, or CARES, and then there's the Coronavirus Response, Relief, Supplemental Appropriations Act, or CRSA, and the American Rescue Plan Act, or the ARP Act. So this federal relief funding has been a complete game changer for childcare and early learning. So I think it's super important to raise that up, though, as I've said many, many times over the last couple of years, unfortunately, it's taken a global pandemic to raise up how critical the early childhood workforce is, and childcare settings, and many different spaces and places. And to Lanet's point, family childcare, for example, a critical component of that childcare workforce. And while the investment is short term, I can't stress enough how important it's been to the sector and to families. Stabilizing the childcare system for a year or two isn't nothing. That is a lot in the lives of the children with access to care. And so super appreciative of the ability for providers who were able to retain those jobs, and the communities who could access this really important funding, could continue to count on childcare programs. So certainly important. And with that relief funding, as Michelle stated, there are all sorts of things that have been happening, including raised wages and bonuses for providers, and in some places lowered costs of care for families, supporting the supply and quality of childcare programs. All of these are really important, again, for that ability for us to sort of bridge this gap that we're trying to bridge. But the timeline for states to spend down this funding is quickly approaching. So by September of 2023, can't believe it's September of 2022 now. That went by super fast. But by 2023 September, states are going to have to liquidate or spend funding under the CARES and CRSA and the Stabilization Grant Program of the ARPA Act. By September 2024, states must liquidate the last of the ARP Act federal relief dollars. So we don't have a lot of time, and we certainly have a lot of need. We are, the progress we're seeing from state legislative sessions as well, I just want to raise up quickly too. It's worth applauding. There are things that are happening. By the end of June, many states have wrapped up their regularly scheduled sessions for the year, though some remain in sessions through the end of the year. So something to look out for is what might be happening in those that still have their session remaining. To be clear, states implemented significant policies during the 2022 legislative sessions to support the early childhood educator workforce and to strengthen the overall childcare system and improve access and affordability for families. So, Dan, some of those things are like, for example, Colorado and Virginia made changes and investments to strengthen their childcare sector, and even reorganized departments or invested in data systems. All of these things help. It may take a bit of time, but this is the building of the infrastructure part, right? Which is so important, given we've had such a fragmented system, if we can call that, for so many decades. We saw several states like Louisiana, Maryland, New York take steps to make childcare more affordable for families. Many places are investing in their early educators through bonuses and wage supplements. And again, recruitment and retention planning, which I'm sure we'll touch on, this whole, really concerning issue around where are these early childhood educators coming from or not coming from, and where are their gaps. We have all sorts of examples on our blog, on our website, so you can even read more. And I'm super energized by these kinds of progressions that we're seeing. These are proof points, which is really helpful for advocates to raise up, to help push Congress, to your point, Dan, that we're not where we wanted to be at this point, certainly not where we thought we were going to be 6 months ago. But these are proof points forward toward additional federal funding and to push states toward more comprehensive policy changes nationwide. And that gives me some hope.
Absolutely, Lynette, thank you. I want to jump in. I get maybe a little bit earlier than I usually would. Nicole has phrased this wonderful question in the chat that is sort of I think a great next place for this conversation to go. So I'll pose this to all three of you. Please weigh in. If you had a crystal ball, what is the future of the early childhood educator? Right? Are there enough new people coming into the field? And how can we raise salaries without significant increases or investments from state or federal governments? I think, one of the things, just as an aside, this is not part of Nicole's question, but my editorializing, one of the things, and Lynette, you just mentioned it, we are seeing states and localities really looking at how to use these one-time dollars in recognition of what is a huge compensation crisis in the field right now. You all know well, Lynette and Michelle, from your proximity to DC, the DC Council has enacted now $10,000 to $14,000 annual increases for early childhood educators. Alabama has used ARPA dollars to extend $3,000 quarterly bonuses, so a $12,000 annual bonus. It seems that on a bipartisan basis across the country, there is increasingly this recognition of the compensation crisis, and really just a question of sort of where to take it next. But what do you see as the future of the workforce, and how do we solve this compensation crisis in the long term?
I'm going to jump in since I'm off mute. So I'll just say that I choose the crystal ball that's what I want to see, right? And what I'm working towards for kids and families. And the crystal ball I would choose in this moment is that we are going to build a substantive, compensated, respected early care and education workforce. The pain along the way, we certainly have experienced, but I don't think we want to also undervalue or underestimate the successes we've seen. There's some big things that are happening, but at the end of the day, how we choose that crystal ball is really going to be about the investment. At the end of the day, it's going to be the public investment, and public good, public good, public good. We have to continue to drive home the message that early care and education from birth is critically important for child outcomes, and frankly, marrying that with family outcomes as it relates to economic security. What a wonderful opportunity to marry both. And early care and education can support both children and families, and then by extension communities, all of the things we spoke into. But it is going to take a public investment and a desire on all of our parts to really understand the import of these early care and education providers. So that's the crystal ball I choose. And it is going to take a lot of whole community, whole nation emphasis on how that actually will happen. I think we're really close. I really do. I'm very optimistic about the direction we're going. So I'll stop there and just say, share that optimism and the crystal ball I choose, and that I think that sometimes when we're in it, it's hard to see and pull up and see the victories we actually have accomplished, because there's so much more work to do. Go us. And I think that there's a lot we've accomplished and can continue to accomplish while pushing this forward.
Lynette, what's in your crystal ball?
Have to echo Lynette and say public good, public good, public good. We have to fund early care and education as a public good. I think we have to make sure that we're dealing with the true cost of care, especially that we're addressing the unique aspects of the different settings that early care and education is delivered from. Also making sure that our regulatory and quality improvement efforts are relevant to the settings, whether that's center-based, school-based, or home-based, and that we're supportive of non-English speaking or dual language learners and dual language educators, because I think that helps to bridge folks into the system and help to build supply, because we know that children are in these spaces. So how do we connect folks to the systems? And of course, I'm going to say, make sure that family child care is included in the delivery of all early care and education systems on par with the other settings.
Michelle, jump in.
Dan, I'm just building on what Lynette and Lanette shared. I want to also use this moment to highlight, in addition to all of us again seeing the profession and early education being valued for the work that they do and the importance of what they're doing for our youngest learners, birth to age 8. To highlight the work of the Power to the Profession, which was born out of following up on the National Academy of Medicine's 2015 report, Transforming the Workforce for Children Birth to Age 8, that a broad base of 15 national organizations came together and talked about how we see this vision that each and every child beginning at birth has that opportunity to benefit from a high quality early education that's delivered by an effective, diverse, well-prepared and well-compensated workforce. And the work that group did, which interestingly was one of the last in-person gatherings before we all went home in the pandemic, to share the findings of many decision cycles, many focus groups, surveys, where we received input from the field and from many stakeholders to talk about how we support what this profession can look like and how they are going to be seen and supported to be able to do the work that we know that they do today, and to be supported in doing that work that is so important for our communities. So the work continues, and that's one thing that is exciting, as building off of what the Power to Profession and the unifying framework created, to continue to think about how we support the workforce and lift up how states can have structures in place that support what quality look like in all the different settings, what it looks like for the workforce to be supported across all settings. And I think one of the things that I love about today's conversation is that we're talking about early education not being focused on any one area. I think that sometimes these conversations tend to focus on centers or just one type of childcare, but that we're talking across the spectrum of the professionals that do this work and how we support them, how we are compensating them, and how we are believing in the work that they do for young children being important for all of us, and frankly, as a long-term investment for our communities and for this country.
Can I just add real quickly too, Dan? You used the words compensation crisis a little earlier, and I think that's such a an important beginning of an alliteration, right? In that we are in the midst of a compensation crisis with our early care and education workforce, and there are other workforces who have been in the midst of compensation crises, and we can do this and push this forward. I think if there's a message that I would send out, particularly in this moment where there's uncertainty about how our advocacy chaps are going to actually see the kind of outcomes we want to see for our workforce, for our children, for our families, for our communities, for our providers of care, that it's a 1 foot forward, and maybe it feels like a lot of steps back, but we really can push this forward, and I think we can get on the other side of this crisis. Other professions have. I saw a little chat come up with, an arm, a strength of an arm come up. I didn't even know what was said, but that gave me sort of this point of inspiration around the fact that we actually have moved forward. We can move forward. Other professions have. And I think the difference for us is that we're in the care profession, right? We're part of that sort of care economy. And there's a significant disparities that this particular workforce, is experiencing. And so, I know we're going to move into many other areas, but I just wanted to raise up those disparities that this workforce experiences by virtue of the fact that many are women of color, and the history of care and childcare specifically, and sort of all of those unfortunate racist and just underpinnings that sort of sit there. We have to have those conversations for us to make sure that we are pushing equity forward, pushing justice forward as part of this equation, and making sure that as we're thinking about the workforce and the compensation crisis, much of that stems from some of these, isms And we've got to make sure that we're speaking into the structural racism and the inequities and the disparities and getting super clear on that. So we can put that in the middle of the room and really understand why we even have a crisis in the first place as it relates to compensation and its relatability to respect for the profession. So so I would just say let's keep that part, that really important foundational part of this equation at the center of our discussions.
Lynette, thank you. And again, please be dropping your questions into the Q&A. We're going to continue going to those here throughout the remainder of the hour. Lynette, I did want to ask you, because it actually piggybacks off of a question in the chat. You mentioned it, and to me, one of the silver linings, if there is such a thing to the pandemic, relates to family childcare, and obviously you've had a lot of background and experience there, but for many years, particularly in certain states, what we felt like we were seeing was a kind of the gradual decline of that we were seeing a lot of drop off in the availability and the number of family childcare programs. And it seems to me, at least anecdotally, that maybe the pandemic has shifted that momentum a little bit, and that families are returning to finding a value in having kind of a smaller setting and a smaller group and a more intimate setting for childcare. And Kipman is asking in the chat, she's saying, I've been hearing that center-based care in New York City in particular is under-enrolled, and yet home-based care is really where they're having the waiting lists and a high demand. Is that something that you're seeing around the country?
Yes, and thank you for teeing it all up and saying all the points. So I don't have a lot to say, but yes, we're definitely seeing that state systems and administrators and all the groups that support early care and education are having a renewed interest and a renewed, I guess, respect. I think that word came up with Lynette, for the home-based setting and understanding the power of the space, and again, for the things that I said that make finding childcare hard for families, when you're talking about non-traditional hours, special needs, home language, home culture, rural areas. So it's easier to come to deal with the facilities of a home-based childcare in a rural area that's going to support up, 6 to 18, whatever the number is for licensing, because that changes in every state and every county and all the things. But it makes it easier to have this small business. And like I said, we need to bridge there are folks that are doing it outside of the system, and we need to figure out the mechanisms to bridge them into the system so that we're aware of where children are, how they're being supported, and that we're making sure that they are school ready and ready for lifelong success. As Lynette said, there's a bridge between the brain development and the child development from birth to school, and workforce supports and community development. So I think family child care is definitely, that is the one silver lining that we've said over and over again of the pandemic, is that the value and importance of family child care in the system. And going back to the legislation that shall not be named, family child care was definitely specifically named as a delivery method for early care and education. So I think family child care is on the rise.
And Lynette and Michelle, I want to let you weigh in on that as well. Anything you want to say on family child care, but maybe extend that question to what are the other silver linings that you're seeing that have maybe come out of the past 2 years?
Go ahead, Michelle, jump in.
So first, I do want to share and appreciate that. I'm loving this discussion that we're talking about all different settings, that the wait lists in family childcare, there are wait lists in centers, there are wait lists in the public school childcare environments. I think we are seeing and hearing that these challenges of what is impacting the workforce and what is happening in programs is prevalent across every setting. And, I think that we are all collectively working towards how we can resolve and challenge and deal with those challenges. I would offer that, it is What's challenging about looking at this is to go to the challenges of the fact that we haven't yet solved compensation, and until we are able to solve to compensation, we really truly won't be able to solve to some of the other things that we've talked about. But there are a couple places where we started to see highlights where, you know, there is movement, where there's positive things that have happened in terms of support of the workforce. And I want to go to talking a little bit about some of the states that have done some exceptional work in this area. And I know that there are many states that are represented today. So please know that if I don't mention your state, it's not that your state isn't doing good work, but you know, I'm thinking about Connecticut finalizing a state budget that included $70 million in state funds to supplement wages for each employed childcare staffer in all settings. And again, thinking about that, loving the fact that they have said, okay, you're an educator, it doesn't matter your setting, we are supporting you. That New Mexico has done a particular recruitment campaign to lift up what this profession does, that talks about the important roles of early childhood educators, that, you know, this campaign is operating in this public space to show and tell the stories of what early education does on behalf of communities. That in Illinois, they created Great Start, which is the strategy to attract and retain teachers wage program that provides biannual wage supplements for teaching staff, rewarding educational attainment and program tenure. And those supplements are paid directly to the individual on a 6-month schedule based on continued employment in their same center and program. So these great examples where we're seeing that there is movement towards being able to address the challenges that we've talked about, to support educators. And we know that there's continued good work being done and will continue to be done, because I'm going to be optimistic and build on the things that we've talked about, that there is a world ahead where we see that educators are supported, and that they are supported in the different places where they're providing care, and the families then are able to access the care that they need in order to be able to participate actively in the places they want to be working.
Michelle, I just want to double click on something you said, because so many states, as you mentioned, are innovating in this space right now, and it's almost hard to keep up with how much, you know, as states are spending their American Rescue Plan Act dollars, for example. But it really is notable that states like Connecticut, like, you know, what New York is working on to expand to more of a universal sort of childcare model, that we're seeing more and more states actually put state dollars on the table. And so, you know, notable and worth lifting up that, you know, that states are really putting their money where their mouth is on this topic as well. Lynette, jump in. What are your other silver linings?
Well, I think a few things. I mean, one is love, you just named one. The state investments, I think, are fantastic. I think there's a reason for that, and getting to the reason. And one of the reasons that I think we all have to grapple with is changing work, right? Work is changing, and how we work is changing, and where we work is changing. All of those things are impacting how we think about early care and education. And I think always having that in mind while we're simultaneously, I think, even getting better about or paying attention to the creation and the evolution and the development of a child care, early care and learning system is by centering families, right? And family experiences. And I think that really is sort of a dot connector to the question you asked about increase in family childcare. Why is that? You know, is it because family childcare programs might be more nimble than a larger center-based program, and how they support children, whether the nimbleness sits in their hours, or whether the nimbleness fits within the context of the size or scope of their particular program, and centering family experience and cultural experiences, language, et cetera. So I get really curious about how when we're thinking about early care and education as a public good, are we also making sure that it's human-centered, family-centered, and designed in such a way that equity is at its core? And will that speak into some of the, even further as we sort of get to that space about what states look like and what they're investing in? So, you know, states are likely investing in childcare because they're businesses within communities are demanding and having a huge pain point for the economic equation of childcare, which is all true and valid. And how do we make those connections to make sure that those state, those state solutions are not reactive, but actually settled into what we know is good for children and families, so that they can actually thrive. And I think that's where we come in, all of us collectively that are on this call today, about how do we inform that, the designing of a new transformed public goods system. I also just wanted to raise up that the experiences through the pandemic have also given light to not only the import of early care and education, but also the experiences of children and families and how children and families actually interact with education. And this is a real opportunity for us, I think, and I think it is happening in some corners where we're thinking about from birth through school age, and that there isn't this, that there's an opportunity to build stronger relationships between K through 12 and from birth through 5. And how do we do that effectively in our work? What we're seeing happening right now with a real challenge around K through 12 educators leaving, we know, right, that this is a crisis that we're experiencing in early care and education. So how do we better bridge those things? I think all of those things are contributing, Dan, to state investment, to how we're thinking about building a system, et cetera, et cetera. One of the things that the phrase that keeps going through my head as we're having this conversation is embrace complexity, because we've probably touched on 25 or more issues that our space is actually grappling with. But that's why I know we can do it, because we can embrace complexity. We have to and can hold all of these things at the same time, as we're trying to move forward. And I'll just add one, Dan, if I can. One other thing that I think we need to hold, as we're moving through these experiences of transformation of the system. And we've all touched on it in some form or fashion, and that's that, our system of care has historically overlooked and marginalized people of color, indigenous communities, rural communities, shift workers, differently abled children, infants and toddlers, immigrant families. We have to ensure we're sort of holding these things up. And I just wanted to make mention of the fact that the Leadership Conference on Civil and Human Rights is a coalition of more than 200 national organizations, including Child Care Aware of America. The first organization actually focused on childcare to become a member, has released principles to guide its advocacy around early care and education. And I know that there is some level of energy on the chat around this. And so I just wanted to raise this up. These principles actually advance concepts that are rooted in basic human dignity. And I would just raise up that there's opportunities for us as, as individuals who are looking to activate and advocate for equitable care, that there's opportunities for us if you care about things like, unfortunately, children of color being disproportionately suspended, for example, from preschool settings, and more likely to bear harsh discipline. Our early care and education workforce that may not be treated fairly and in a manner that reflects the values that they provide to families and communities. These are ways that we can step outside or to connected areas, to make sure that everyone's raising up how important early learning is to making some advancements towards racial justice and gender equity and disability rights and so forth. So I would just raise that up as another opportunity for us to make strong and intentional connections.
Absolutely. Michelle, I want to ask you, I'm looking through the questions from the audience. I would venture the guess that about a quarter or a third of them all relate thematically to what I'm going to call the cliff that is coming. The states have taken somewhat differing approaches in their use of these federal dollars, but the red thread that kind of runs through all of the states' approaches, for the most part, is the stabilization grants that I think you referenced earlier. And so, with the knowledge that the industry right now is being held together, at least in part, by virtue of these stabilization grants that have been made available with federal funds that, as Lynette has spelled out, are going to be going away. starting a year from now, if they're not already, in some cases, pretty close to expended, and then ARPA by 2024. What are you hearing from the field? NACI has done such a great job of listening and surveying providers all throughout the pandemic. What is your concern for when we hit that cliff? What do you see happening? And if we can go back into the crystal ball, what would the impact be? I'm not going to presume that it'll happen, but what would the impact be of an absence of additional federal funding here?
Well, Dan, because I want to believe optimistically that there is going to continue to be recognition of the importance of this field. I would like to believe that the cliff isn't going to happen. That we are going to work towards saying that we need to be addressing the fact that it is coming right now in terms of how it looks, but we need to be working towards continuing to lift up the ways that we have prevented closures of programs, people from leaving this field because of the funding that has existed. We will need to have those substantial sustainable investments. Otherwise, our nation is going to continue to struggle to address systemic challenges that have plagued the market for parents and for providers. And then frankly, just continue to amplify the scale and urgency of the childcare prices, the deserts, the equity issues, the low compensation. I do want to share that I think one of the questions we've received when you ask, like, what are we hearing from the field and what are providers worried about? Well, they are very worried about that looming cliff. And they're worried that sometimes they're hearing that states are not seeing the way forward in terms of some of the spending for that. And we are encouraging in our partnerships and discussions for states to continue to see the ways that they can help support the field, not only from the ways that I mentioned earlier in terms of some of the things that have been done related to compensation, but other aspects of just operating childcare programs that are realities that states and localities can address. For example, dedicating funds to higher education access and quality, including comprehensive scholarships, loan forgiveness, professional development supports for incumbent and aspiring educators, aligning requirements. There are many people who are here on the call today who know about the challenges with regards to licensing, quality rating systems, accreditation, all the regulatory systems. We can do some work to better align and streamline those efforts and support educators by addressing those challenges. Covering the cost of facility improvements. We've been talking about climate and the impact of climate change, the things that are being asked of providers, including improvements for facilities are needed, but providers need support, whether they're family child care providers or their centers. We want to keep our children safe, but those are things that are costly for providers that states and localities can be intentional to help provide supports, or even improving zoning regulations that impact child care centers and homes. Making it easier for us to be able to get to the heart of supply and providing the things that educators and our programs need. These are some of the other ways that we've been hearing from our educators and providers that they're hoping that states and localities are addressing when they think about the challenges, in addition to compensation. And then, to go back to one thing I want to, highlight is some of that conversation that we've had around businesses and the unique aspect that they can play in addressing something that is a significant pain point for them, which is that they won't be able to have people in the workforce if they aren't able to help address some of the challenges, and that there's a unique role there. That's actually how I entered the world of early education, was looking at the opportunity that businesses can provide in engaging in providing for high quality early education. And that's something that I think that is a discussion that we know that has been happening, will continue to happen, especially as we see that there are, this untenable challenge right now that that parents can't pay more, the educators can't be paid less, and we need to find other ways to be able to address the challenges that are out there. But I know when I think again optimistically that we can, and we're going to continue to hope and work against the cliff that we talk about, while continuing to elevate the ways that we can solve to the complexities of our industry.
Michelle, thank you. And we just, a couple of us, Lynette wasn't able to be there, and her colleague Ann Hedgepeth was with us, but we were all together in Phoenix just a little over a week ago at the Hunt Institute's Early Childhood Leadership Summit, and had 400 policymakers in that room from red states and blue states and all across the political spectrum. So, I would say, personally, I left that convening really inspired to see the level of bipartisan support. I think it's easy sometimes to look at what can be a very divisive kind of national political conversation and assume that this is just all hopelessly partisan and not something where progress can be made. But boy, that's not my my takeaway. Having sat with these leaders in the room, what do you all project in terms of what's next in Congress? We've got a midterm election coming up in November. Is there, Lynette, in your mind, is there a path forward for federal action here and some sort of bipartisan solution?
I absolutely believe that's true. And actually, Dan, you got from Michelle's comments exactly where I was going as well, in terms of as I was listening to you, Michelle, and you, Lynette, as well, where I went in my head is, gosh, there are just so many champions. There are so many reasons in so many ways to push this agenda forward. And I think we're seeing it. Like, again, there's been a lot of progress, and we did see a lot of investment in the most challenging moment. And to respond to your question, Dan, I absolutely feel very confident that something is going to happen. I am not sure how big a step we're going to make and how transformative we're going to get in the nearest time. But I think that there truly is no going back. And that's, I think, where I would share with everyone, that there really is a necessity for us to continue to push forward. That I think that, again, we're heartened by some prominent members of Congress, such as, Senators Kaine and Schumer and Murray, being vocal in their support of childcare. I think there is more of that, much more of that brings me hope that we actually can make something happen at the state and the local level, as well as at the federal level. I think there are champions that are raising, they may be entering the house of care from a different perspective. They may be coming in a window versus a door versus, but the door may be labeled a little differently, but at the end of the day, it's still childcare. It's still early care and education. And they all want to see that house look different and better and in service to whatever it is that they feel is super important for an economic engine, for, a child development equation, for family support, for community support. And that's okay. Let's enter into the door, through the doors that have the most meaning for us. But at the end of the day, we're changing the whole house. And I think we can transform this house of care and early care and education in a really positive way. So whether that's in, Dan, November or, next year is yet to be seen. But I really believe there's no turning back. It's just a matter of what we're going to be able to change as quickly as possible. And footnote, I agree with Michelle that, until we solve the compensation equation, we're going to continue to fight a very complex fight.
Absolutely. Lana, what were your takeaways from Phoenix on the bipartisanship front?
Well, I was thinking of, lots of things. I was thinking about tax credits and how states have been innovative. My home state, very innovative in the use of tax credits and in support of early care and education. And a lot of the states were talking about how that can work. Also, the public-private partnerships and business investing in childcare in either slots or housing. For I think the way that it came up in the convening was housing for educators, but I say housing for the businesses as well. And then also there are local millages and people, I think the rubber meets the road in states and cities and counties. And so, although we talk about the federal legislation, the things that actually impact people's lives and how they run their businesses and how children are educated has to do with local policy. So I'm really, really excited that that local folks are putting their dollars up, like I said, with millages, state investments, and business investment in early care and education. And it was very, I guess, wind beneath my wings to see everyone together, no matter what color, understanding that this is required, it's necessary.
And Michelle, close us out. What do you see on the horizon?
Well, Dan, I would say that we know that childcare and early childhood education is a bipartisan issue, and as we face this this monumental election ahead too, that it's going to be important that candidates really understand what early childhood education means in their communities. And I would say that some of the most impactful times that we have seen change is when educators come forward and bring their voice and their story forward to share the life-changing work that's happening, the joy in the play that's happening in all settings. And so I would leave us with the note of, I have hope for our future because I know this field and I know that all that we do is so important in terms of the day-to-day work and all the different settings. I have hope for elevating these issues on, in decision makers' view. And I'm excited that we are going to continue a path forward with all of the collective voices of those who have joined today and those who are out there doing this important work.
What a great way to wrap us up. Our hour flew by as I knew it would with this fantastic panel. Join me in thanking Michelle Kang, who is Chief Executive Officer at the National Association for the Education of Young Children, Dr. Lynette Fraga, CEO of Child Care Aware of America, and Dr. Lanette Dumas, the President and CEO of Pharrell Consulting Group. All three of you, thank you so much for taking time out of your busy schedules to take part in this important conversation today. And importantly, just thank you for the work that you do on behalf of kids in this country. You three are all treasures to the field, and what a treat as always to connect with you. I want to thank everybody who tuned in today as well. It's just always a joy to watch, particularly as we're going through these hours, to watch the chat go by and to see how many great friends and colleagues are tuning in from all over the country. Thanks for taking the time out to be with us. Do want to mention that October is Hispanic Heritage Month, and we will be back in early October. I believe it's October 4th, first Tuesday of October, with a great session on the legacy of Latina leadership in early childhood. Really looking forward to that in October, and hope that you can join us. You can check out the Hunt Institute's social media, or if you just Google webinars, Hunt Institute, you'll come up on our webpage. There's a great page. You can sign up not only for our early childhood offerings, but for any of the other terrific online programs that the Institute is putting together in the coming weeks. So hope you'll take advantage of that. And again, thanks everybody. Wishing you a great afternoon, and thanks for joining us.